Imagine trying to do something good for your body, like make a high-protein smoothie for breakfast or after a workout, only to find your protein powder is full of junk. Heavy metals, artificial sweeteners, and chemicals you can't even pronounce. It is frustrating when you try to do the right thing, but instead you just end up adding to the toxic burden in your body. As someone who cares deeply about what goes into my body, as well as the patients that I work with, I believe that what we consume regularly needs to support our health, not silently sabotage it. That's why I use Puri. Their protein powder is made from clean, high-quality ingredients, and it's third-party tested for heavy metals and contaminants because they don't just say it's pure, they actually prove it. You can find collagen peptides, whey protein, and plant-based options on their website. Check them out at puri.com, that's PUORI.com, and use the code LIFEAFTERIMPACT for a 20% discount on your first order. This is part 2 of my important conversation with Dr. Tatiana Habanova, where we discuss neuroendocrine changes that can happen after a concussion that has an impact on thyroid and adrenal function, as well as blood sugar control. We also discuss the importance of more consistent neurocognitive testing and screening for monitoring brain function. I hope you enjoy this conversation. Please subscribe to our show so you don't miss an episode. And as always, you can email us questions at lifeafterimpact@gmail.com or send us a text by clicking on the Text Us link in the show notes. Welcome to Life After Impact, the Concussion Recovery Podcast. I'm Dr. Ayla Wolf, and I will be hosting today's episode where we help you navigate the often confusing, frustrating, and overwhelming journey of concussion and brain injury recovery. This podcast is your go-to resource for actionable information, whether you're dealing with a recent concussion, struggling with post-concussion syndrome, or just feeling stuck in your healing process. In each episode, we dive deep into the symptoms, testing, treatments, and neurological insights that can help you move forward with clarity and confidence. We bring you leading experts in the world of brain health, functional neurology, and rehabilitation to share their wisdom and strategies. So if you're feeling lost, hopeless, or like no one understands what you're going through, know that you are not alone. This podcast can be your guide and partner in recovery, helping you build a better life after impact. I have certainly had patients that have, after a concussion, they've actually developed thyroid conditions. I've actually seen people go hypothyroid, and I've seen people go hyperthyroid. And so why don't you talk a little bit about this research that was published in 2023 where they were looking at pituitary levels, and obviously the pituitary then talks to the thyroid, the ovaries, the adrenals. So maybe get a little bit into some of this newer research that is looking at these types of changes.
Yes, absolutely. So really it's just a trickle-down downstream effect. It's really almost a secondary hypothyroidism as opposed to a primary condition around the thyroid. So I know sometimes language and words that we use to explain things in the medical world can be slightly confusing. So we really have to tease that out. So it's probably not a direct issue at the thyroid, although we obviously want to make sure there's no growth or problems. Maybe there's an autoimmune condition at the thyroid. That could certainly happen. So we got to be careful. But it's usually a downstream effect coming from the pituitary. Now, we can't really address the hypothalamus per se. So we can assess from the pituitary level and then, of course, downstream from that. So definitely, current research is indicating that and this is the interesting thing I thought was nice to see. They now say it doesn't matter the level of injury. Like they used to believe a more severe injury would lead to more severe hypothyroidism, low hypopituitaryism, low pituitary function, which would then lead to low thyroid function, which would lead to low adrenal function, right? So it's just a downstream effect. Now, actually, research is showing that it doesn't matter the degree of injury, even mild, TBIs, which are concussions, can even cause those issues. So definitely seeing what they recommend is to have let me take a step back. Some recommend doing an assessment at the acute phase. Okay, when you first have the concussion, go ahead and just do the hormonal panel at that moment and just sort of document what's going on. Others are like, give it a few weeks, maybe even 6 weeks, let kind of everything, let the dust settle, so to speak, and then take the assessment at that point and see sort of how has the system kind of rallied back. And then from that point, if there's issues, consider moving forward, in care, treatment, and continuation of assessing long term in that management, right? So there's a couple of ways to go about that, but definitely, seeing changes, those neuroendocrine changes, which of course for the thyroid is so important for brain function. So not only is a person maybe dealing with the concussive symptoms, whatever that profile might look like, now there's an added layer that kind of comes back and nips them, in the bud, like in kind of a round two, where, maybe it's just now new symptoms are showing up, or symptoms are getting more manifested, at a greater degree. And the approach they were doing to manage them isn't working anymore. Right. So like with headaches, for example, you spoke about earlier, maybe they were managing them a certain way and that worked until the shoe dropped, because that neuroendocrine change, was affected. It took several weeks to months to do what it's going to do, and it didn't rally back. So throughout that time, maybe there weren't those thyroid symptoms just yet, but now there are, because it's dropped so much. And here 2-3 months, 6 months later, poof, a new manifestations occurring, or the treatment is not working anymore. That's again, when I talked about that stagnation, we need to go back and evaluate if we haven't initially.
Yeah. And I think there's a really important piece here too, where if you look at, like you mentioned, it'd be great if we could all just get a baseline hormone test, just to know where things are at. But I think a big piece here is that when you have a brain injury, as people's brain heals, then also if there's a pituitary dysfunction or imbalance, then that is all, as the brain heals, that can also heal. And so it might be a case too, where if somebody does get put on a thyroid medication, we maybe shouldn't wait a year to recheck it, right? Maybe we shouldn't even wait 6 months to check it, because as the brain heals, they might not need the same dose. And so I think that that's also important too, is that in the context of a brain injury, if somebody is taking medications to manage a thyroid disorder, that might need to actually be like retested every 3 months instead of every 6 months or every year.
Absolutely. That's exactly the take home point. And you're right. Again, that thyroid medication may be a needed ingredient to help also the brain heal, right? In addition to other things that's going on for the brain to heal. And maybe the brain needed that little bit of thyroid hormone in the brain to be able to do that, right? And then it heals up, and now maybe we need to titrate that down or slowly take it away and not become dependent on it. And I think currently in the field of medicine, thyroid's not looked at that way. It's sort of looked at, you go hypo, and then you most likely need meds your whole life. And then maybe they're just going to slightly tweak the levels because, maybe someone's feeling a racing heart or right? So they're going to start to maybe kind of play with the dose, but they never take you off of it, right? Or look to maybe wean out completely. And again, maybe that is needed, maybe it's not, but I agree with you. I agree with the idea of providing it if necessary, and then seeing how the brain develops, right? And heals.
Yeah. And I think you just mentioned a beating heart, which made me want to point out the fact too, that we, in functional neurology, we spend so much time assessing for autonomic dysregulation. And so it is really important to also see this overlap between thyroid disorders, and a lot of the symptoms kind of overlap with a dysautonomia type presentation too. And so it just like makes, like you said, it's just the ability to understand the functional medicine and the functional neurology at the same time is so huge.
Exactly. That makes me think of a case I had about 4 years ago with a patient who had a history of concussion and previous, and was on thyroid medication for a very long time, maybe 30 plus years, and constantly spoke about a racing heart. Like she used to call it like horses are pounding in my chest. Like when horses run, you hear their hooves, they kind of that beating. And so she was going to her doctor constantly about the thyroid, and they didn't want to change levels because they're at the highest you can be, and they take her too low, and then she would have some thyroid crashes because, again, there's some dependency a little bit on the meds too, because the system isn't kind of working on its own. It's working on the environment it's provided with, right? So again, that could be a challenging river to navigate to some degree as well. And but just never could get it right, and always felt it was the thyroid, and had brain fog and all this, and evaluated her, and she had dysautonomia.
Mm.
And so treated the dysautonomia, and the racing heart went away, and was able to lower her thyroid meds to some degree. She still did require some, but not to the degree that she was. No more racing hearts, and the energy levels, brain fog, a lot of things help. But again, was it dysautonomia? Was it over medication of the thyroid? It's really takes, I think, a practitioner who can peel back multiple layers and look at the person from different perspectives.
Yeah, yeah. I had a patient that was in a lot of pain after her concussion. She also had an injury to her neck, and so being on a lot of pain can cause your blood pressure to rise. And so she was placed on a blood pressure medication at some point, and I think what happened was, maybe the pain levels came down, but she was still on the blood pressure medication, and so a lot of the autonomic nervous system, like the dysautonomia piece, wasn't getting better because she had this medication artificially decreasing her blood pressure. And it was like once she went off of that, because she was able to track the blood pressure, say to her doctor, hey, this is consistently low. Like, I don't think I need to be on this medication. And so they said, yep, you're right. I'm looking at the data here. Let's take you off of it. And then all of a sudden the dysautonomia improved. And instead of plateauing, it's like all of a sudden it's like her progress just shot way up. And
Right.
so it just really highlights that importance of, like, in the case of concussion recovery, we've got to be paying attention to all the data, the hormones, the blood pressure, the autonomics. If we've got any medications that are controlling any piece of this, as things improve, or if people plateau, we got to step back and say, okay, is all of this stuff still needed at the moment?
Right. And I think you hit upon some two really important pieces is allowing patients to take on more responsibility of tracking symptoms, right? So like tracking the blood pressure regularly, or whatever the case is, and keeping a little journal or log, like really normalizing that, really allowing patients to just take that time to do that and recognize how key that is. That data is so important, right? So that data collection, and then working cooperatively with their primary care physician, and being able to say, okay, let's work on this where the medication is needed for a time being. But as
Mm-hmm.
the system heals, let's work on normalizing and maybe getting off of it if needed or whatnot, right? So that collaborative piece amongst professionals, and really to serve the patient at the highest level.
Yeah. Yeah. It takes a lot of, awareness of all the moving parts. So,
Yes, it does.
and then when you are seeing these hormonal imbalances and things showing up on labs, that are cluing you into, say, a pituitary imbalance having downstream consequences, do you want to talk a little bit about your approach to working with those patients? I've been drinking Purity coffee now for over 2 years. And one of the things that I absolutely love about Purity coffee is the fact that they do rigorous testing for mold toxins, pesticides, and heavy metals, which allows me to be able to drink their coffee and rest easy knowing that I am not consuming toxic chemicals, mycotoxins, or possibly heavy metals. I know a lot of our listeners are paying a lot of attention to their health and trying to do everything they can to stay healthy. And if you are a coffee drinker, one of the things that I would recommend is making sure that you're drinking a coffee that isn't putting more toxins into your body. If you would like to try Purity Coffee, you can get 20% off your first order using our promo code LIFEAFTER20 by going to puritycoffee.com and entering that in the promo code box at checkout.
Sure. So kind of after initial kind of meeting, and a lot of times I am in favor of getting some lab tests done on the front end. Sometimes patients will already have some recent blood work that they've done, so I always ask them to send that to me if it's within 3 months. Can utilize that data. I find a lot of times they're not very complete, or a lot of bits are missing, so we'll have to just go out and get a little bit more testing if we need to fill in a few gaps. But really then, upon doing a comprehensive neurological evaluation, I take about 3 hours to do that comprehensive assessment. So again, information gathering, data gathering, and being able to look at what are the primary areas that are needed, depending again on symptomology and what they're presenting with, right? So then I like to prioritize for patients sort of how can we best achieve their goals, right? Usually most people want to get out of pain. They want to function better. They want to have brain fog. They want to feel dizzy, headaches, like whatever those things are. We'll start to identify their goals, and then I'll lay out trajectories or paths and be, okay, this is the goal you want to achieve. This is what I feel we need to do to achieve that. And then I'll really ask them, what do they want to take on? What gravitates to them the most? What matters to them the most? And what are they willing to take on? Because I think what's also important before I start working with anyone and really getting, involved in their care, is I want them to be aware of the things that they're going to have, what hurdles they're going to have to cross, and to also start preparing for some of that. So not all of a sudden, oh, okay, here we are, and now you need this. And they're like, oh, because many times when you have brain fog, you're not firing off all pistons. It takes a lot of energy just to do something simple, right? The resources are limited. You're probably not sleeping very well, right? So there's a little bit of that going on. Symptoms, pain, all of that can just add to the burden, right? So I want to try to make it as simple as possible for patients to be able to feel they can be empowered, to feel like they're in control, that I'm guiding them so that they feel confident in the path that they're taking, but that they feel comfortable what they're taking on. And the most important part is creating that compassion and safety, right? So that's really kind of how I begin leading those cases. They can take a long time in the sense that it could be a 6 month to a year process together. We're not just going to solve some things immediately. Some things may happen quickly, which is great, and some things can take a little longer. So, what are things we're going to do to manage some of the symptoms in the meantime? What are going to be things that we're going to heal and improve? And what does that take? So I think it's really important to have an honest conversation about that so people can make a decision that makes sense for them, and the willingness to take that journey on and to do that together. So I'm not sure if I answered the question where you were leading it, but.
Mm-hmm. Well, I mean, you bring up that important concept of expectations. And I think that when you do all that work on the front end and you spend the 3 hours, assessing somebody and looking at all the data and then maybe collecting more data, a lot of times what happens is that because you spent all that time on the front end, you can very quickly get to here's what is wrong, here's what the problem is. But then the patient says, oh, well, they were so quick to figure out what's wrong, so that must mean that they were going to be really quick to fix it too. And like you said, sometimes it takes a while. And so managing those expectations is huge.
Yes, and even on my end, because trust me, if I could wave that magic wand and make it all go away like this, I would be waving it all day for everybody. So I tell them I can only work as fast, and guide you and support you and coach you, and address these things as I have to respect your body and your body's healing time. I can't push you or push your body and brain more than it's capable of. And that's a really important piece, because if we over fatigue, we end up crashing the system, and now we're kind of, putting ourselves behind the 8 ball, right? That doesn't make sense. So again, managing those expectations and guiding them, even in their life, because people tend to take on more than, and sometimes can set back their healing a little bit too. So really supporting him in that. But definitely if I'm seeing some issues, on the thyroid side, because I don't prescribe medications, that is something where I'll refer them to their primary or another physician if that support is needed. Many times we'll also work on supplementations and other things to kind of support the need for the body to work better, just support cellular function. So, with the endocrine system, particularly, looking at neuroendocrine burdens, right? So what are things that are affecting the hormonal system from working as well? When I'm talking about now receptor sites. So are we dealing with toxicities and things of where we could do some liver support and maybe, clear out some things, some toxins and burdens that will allow your hormonal system to actually function better, right? So it's almost like I say you have a knapsack with a bunch of rocks in it or boulders and you're trying to run up a hill. That's really darn hard. But why don't we take that knapsack off? Boy, you can sprint up no problemo, right?
Mm-hmm.
So let's deal and look at sometimes instead of always working from a mindset of let's just improve, 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 improve. Why don't we stop and take a look and go behind our shoulder and kind of look, what are some of the burdens that are occurring to the system? What's going on dietarily? Are the things that we may be consuming that have pesticides in them, or we're exposed to environmental toxins? Maybe we should do a panel and see if there is mold or, various infections or other things that are maybe burdening and pulling the system down. So I think that's an important thing as well, instead of saying, oh, let's just always try to create peak performance for these hormones. So again, another mindset of consideration. Their history will dictate some of this, of course, right?
Yeah.
Women that are in their perimenopausal and menopausal, we now need to be thinking a little bit on hormones and what's going on there. So definitely I start to see changes in progesterone as women are in their perimenopausal phases where progesterone is starting to decrease. So that is going to not be as much of a neuroprotective effect and create a little bit of a heightened anxiety around things as well. So in terms of managing patients that might have these neuroendocrine changes, perhaps due to a concussion, perhaps just neuroendocrine changes that are happening in life, to also support them from that perspective as well. So the literature doesn't speak per se to any of the sex hormone changes. They're really talking more about that pituitary and the thyroid and the adrenal, the cortical. They do also now mention growth hormone and insulin growth factor starting to be influenced. So that is going to now link back up to sugar handling. Okay, so that's important from an energetics perspective. So energy metabolism. So how else do I manage neuroendocrine changes is I look at bioenergetics. I know you've talked a lot on your podcast about red light therapy. I also like to do a lot of PEMF, pulse electromagnetic stimulation as well. So other ways to provide energy to the system, supplementation, herbs, there's a variety of things, lifestyle changes to support those processes too. So I think we've got to look at it from a practitioner's perspective, a few different angles, and for patients to realize, oh, there's a lot of choices and options that I can maybe explore when I'm trying to stabilize a system or improve upon a system. What are some rocks that I haven't turned over yet to explore? Again, those neuroendocrine disruptors. Right. There are several that we know in the food and just, chemicals and water and things like that. Should I get a, water purifier? Should I just, shop slightly differently, eat slightly differently? That goes a long way. That really goes a long way.
Yeah.
And then, looking at some energetics, as well. So I kind of, again, looking at the case really guides me, but these are all the things that I have at my disposal that I'm kind of considering as I kind of have this imaginary whiteboard in front of me as I, have all the dots for the patient and, all that information I'm kind of holding in my mind.
Yeah.
But these are the kind of things that I'm thinking about as well. There's nothing really we can do for the pituitary specifically. We can only do like the downstream.
Mm-hmm. Yeah.
So, yeah. And then stress, right? So cortisol, the other component maybe we haven't discussed if you want to approach that or not, but looking at cortisol, elevation of cortisol and dysregulation of the circadian rhythm, and just stress overall, right? And the influence that has on neuroendocrine effects.
Yeah. When you do the Dutch test, are you typically ordering the one that includes the cortisol awakening response to look at that cortisol activity first thing in the morning within that first hour?
I do, absolutely. And there's always disruptions, in that circadian rhythm. And then also I look at the drop that occurs around the lunchtime hour, because that is when the adrenals need to kick in to provide the cortisol as the circadian rhythm will naturally decline. That's a natural circadian rhythm. It should drop and then kind of level out around 5 p.m., right? So it should start to rise in the morning. We do want cortisol first in the morning. That is a very good thing. That creates an awakening response. So, if some of these people are alarmed that their cortisol is so high in the morning, it's like, well, relatively, right? So, but then I look at the peak and I look at that drop. And generally that's where people have that afternoon lull, right? Sometimes it could be kind of eating food. Maybe they have some, glucose intolerance. So they're eating lunch and then they get sleepy, tired, drowsy 15 to 30 minutes after a meal. Well, that's a glucose metabolism issue, right? But assuming it's not that, they just kind of feel a drop in energy and then they kind of get better later in the day. Those adrenals are not kicking in and supporting the dropping of the cortisol, and the adrenals are supposed to, bring it in and to kind of level you out slowly, right? Not a crash. So there is herbs that can be used to support that process to help kind of bring you down more comfortably. And I find that very, very effective for people to manage their energy so they don't crash. They can be productive all day, keep going. We know movement, brain function, thinking, body movement is so important for brain health and brain healing. So
Absolutely.
again, managing and supporting those effects.
Well, you have shared a wealth of information. Do you want to talk a little bit? You said at one point somewhere you're on a mission to provide annual brain health assessments to everybody. So tell me a little bit about what that looks like, because I think that this is something that I would love to see this happen if we were in charge of healthcare. Right? This is what we would implement. No.
I think to some level there might be bigger powers in motion. There's some amazing women already on, I think, moving this torch forward as well. So I'm happy to be one of those voices to continue to create that movement, and not just particularly for women, but definitely for everyone. In terms of, we go to the eye doctor once a year. We go to the dentist maybe once or twice a year. We get a yearly physical. These are normal, little moments of assessments that we do in our health, right? It's just norm. It is what we do. But we don't do that for our brain. And why not? We're living longer. We want a longevity health, especially if we've had a history of concussion or any brain injury. I think it becomes a more of a due diligence that you take it upon yourself to say, hey, if your practitioner is not recommending this, which most of them aren't at this moment, but trust me, time will come, they will be, and this will be a norm. How that looks like, I'm trying to develop a model right now of what should be included, because as you know, we could do so many elements to neurological assessments, and we don't want it to be taxing and too comprehensive in the sense where it takes so many hours and it's difficult to implement into a practice and for people to come in and maybe get it in a 1-hour visit, right? So keep it doable, to keep it the right information and things like that. So I'm trying to create a model and a standard or a beginnings of something that we can do. But the idea of that yearly is so critical because it's going to pick up on anything that maybe you need to work on that you don't realize, right? It's just sort of like you get a dental and you realize, oh, you have a little cavity. Well, you better deal with it. You better do something. You're not going to just let it go. You're going to treat it, right? Or your eye prescription maybe needs to change slightly, right? So you go ahead and change your prescription, get new contacts or glasses. It's just what happens. So why not here? And why not move forward in life with the best brain that you possibly can have, right? Because should something happen like a concussion or some brain injury, going into the concussion is so important that you never want to have a concussion. I don't want that for anybody, but should that happen, you want to go into it with the best brain possible. And the only way you can do that is you keep tabs on it. If you don't measure it, you don't know what's going on. So I think that idea of just doing that yearly and then checking again the next year and everything's the same, awesome. If things have altered a little bit, let's fix that. And again, it's always better it'll only be a quick little fix. It won't be major, right? Now, if there's something that we need to work on, let's work on it. Let's get that sorted out. and then you're good again. Let's move forward, right? So, so that's kind of the mission there, and just that. The stigma around the cognitive aspects of it. Most people are pretty comfortable having their vestibular system evaluated, or the cervical, the neck, and various things. But sometimes when it comes to the cognitive, people don't sometimes really want to take those cognitive tests because they don't want to know, because I think they're afraid that maybe the test is going to show that they have some, a cognitive decline.
Mm-hmm.
And they feel at this moment, still in society, there's people who are doing amazing work of altering that stigma and helping people realize that even with mild cognitive impairment, there's things that we can do to turn that boat around and improve brain health. Having an evaluation that shows that there's some mild cognitive impairment is not a death sentence or a sentence to Alzheimer's. There isn't that. But we don't want, if we leave it unattended, maybe it might lead to that. So why be risky like that? Why not take care of it? I personally would rather learn about something sooner than later. So there's still a few things to kind of help people in terms of navigating that and learning and education. And you do just such an amazing job on your podcast, sharing this information, helping listeners, really get to the truth behind things. And so, I just support you 1,000 different ways
Thank you.
in all your pursuits as well, and the work that you do in the world and in your clinic and personally with patients. So, but yeah, the yearly brain health assessment, I think, is something that should be normalized. I'd love to see more practitioners do it. I think they're not sure just how to, not how, people know what tests to do, just how well to structure. So I'm working on a doable model that people can just cookie cutter, tweak it to obviously your patient appropriately, but something easy to implement. And there you go. There's the blueprint. Go have at it. And let's get this going.
And like you said, I think a lot of people they're okay being assessed, other things being assessed, but as soon as you say, let's assess your brain, it's almost like people have reminiscence of like high school math test, right? Or they're all of a sudden having like test anxiety, or they are reminiscent of this whole grading system in school, and it's like, oh, you're going to make me do a test. And so I think that that's a little bit, like you said, of a hesitancy where people are like, I'm fine. I don't want you to look at my brain. I don't want to be tested. And it's like, we're not testing your intelligence. We're just assessing different cognitive functions. It's not an intelligence test.
Exactly. And that's a key point there. And also I find like some people honestly don't want to know, they're in denial. So there's that. But also what I find is if there are cognitive changes, right? Mild cognitive changes. So it's not like drastic, right? Somebody's after a concussion, you can have significant cognitive changes like this, right? And it is clear. That was a little bit my experience. I think maybe your experience to some degree as well, right? But the mild cognitive changes, people start to shrink their world so they could operate in a way that they can tolerate to their brain function. So they don't realize that their world is shrinking to some degree, so they can keep managing within that well, because we all want to do well. We want to feel well and good and successful, right? It's very important. So, but they don't realize they're shrinking their world. And then when you expose them to some standardized cognitive tests, and again, not to make them feel bad, but just to say, hey, here's a benchmark of really the level you should be functioning at, right? And that's where we want to get you to. And we can make that happen, right? If possible, right? So again, don't make promises you can't do. But again, let's say realistically, I think that really helps sometimes people realize like, oh, wow, because they feel I'm fine. I can drive. I can go to work. I can do this and this and this. My life's okay. I don't need that. Right. And it's like, well, okay, let's just kind of measure you to some standards. Is your world shrinking or not? Because the smaller it gets, the smaller it gets, the smaller it gets, the less of an existence we have. And there's so much to enjoy in this world. And we don't want to limit our potential, our abilities, and our experiences. So I find also that has been the case for many people too, where they're thankful afterwards. And they're like, wow, I had no idea that that was happening, because I felt, you put them in a new environment, you put them a little bit outside their world, and now can you navigate things if you're not in the familiarity of your own little space?
Yeah.
Right.
And the other thing that I see is that when people have had a concussion, if their executive functioning is affected to some degree, part of executive functioning is internal self-monitoring and self-awareness. And so some people are not able to have that self-awareness of when they're making mistakes. And so they might actually not even understand the degree to which the concussion has been affecting them cognitively until somebody comes in and says, let's just look at these functions. Let's assess them and then maybe shine a light on where you're struggling.
Absolutely. I think that's a good point. And that many times that's what I do. I just shine a light on people as well. They may not want to pursue this or that if something showed up. Sometimes they do, sometimes they don't. But I said, hey, at least we have data. And this was a case actually with a patient of mine 4 years ago. We did a little mini evaluation. She's an equestrian athlete and left for season. So they go up north and then back. So working together. And this season, actually just a few months ago, I was like, you know what? We haven't, done assessment for a while. Why don't we just run that real quick? Right? I mean, we didn't do anything about it before, but we gathered some data. Why not just take a few minutes? Let's just run a few tests, right? Well, she was significantly worse at this current moment than she was 4 years ago. And that opened her eyes up. She's like, oh, wow. And I was like, we have a concussion in these last 4 years. Now, of course, she had a little history prior to that, but, she felt she was functioning fine. It happens, life happens, but she's like, oh yeah, I did fall off a horse in September.
Oh, wow.
I didn't really think that affected me in any way. And here we are in February, March, I believe it was when we did it. So again, many months after that incident, she got right back on the horse and she's like, I felt a little off for a couple days, but whatever, and carried on. And so, wow, now that we did our comparison, she just said, thank God we did that 4 years ago. She said, Tom, I really didn't want to do it, but I did it because you kind of,
I did it to make you happy, but now I'm glad I did it.
She kind of did. She kind of did. I bless her. But I'm good. Grateful that we just did that. Now we did some neuro rehab and cleaned that all up. And 2 months later, now she's left for season again, and she's doing a whole lot better.
Amazing.
So,
yeah. What a great example.
Exactly. So even if it, think it doesn't really matter, I think this is why it should just be a part of it. Annual. You don't think there's a problem, but hey, let's just take a look. Let's document it. Let's just keep some tabs. Same with the hormonal changes. Women should definitely be managing and tracking their menstrual phases, even postmenopausal or perimenopausals and things like that, or any type that someone has a concussion. I think they should just get a little notebook out, and start writing down and tracking some of those symptoms as well, so that a physician can maybe then look at it and piece it together.
Yeah. Awesome. Yeah. Well, you have shared such a wealth of information that I think a lot of people are going to be, it's going to be eye-opening and fascinating for a lot of people to be able to listen to this. So thank you so much for coming on the show. Why don't you tell us where people can find you?
Absolutely. You can just reach out to Palm Beach Brain Center. I'm actually not heavily on social media as I once was in the past, trying to do a little bit of detoxing in terms of mental health and well-being. So you can just go to the website, palmbeachbraincenter.com, or, the phone number and email is there. You could always reach out that way if you have any questions.
Wonderful. Amazing. Thank you so much, Dr. Tatiana.
Thank you so much for having me on your podcast and to share this time with your listeners. I'm really appreciative and grateful for our time together.
Thank you. Medical disclaimer. This video or podcast is for general informational purposes only and does not constitute the practice of medicine or other professional healthcare services, including the giving of medical advice. No doctor-patient relationship is formed. The use of this information and materials included is at the user's own risk. The content of this video or podcast is not intended to be a substitute for medical advice, diagnosis, or treatment, and consumers of this information should seek the advice of a medical professional for any and all health-related issues. A link to our full medical disclaimer is available in the notes.